slide.
Mm.
Hello, Dr. Hema and Vilasini. We also have participants on the call, but we're waiting for more people to join, so we'll start in 5 minutes.
Sure, sure. Is there a lot of background noise in my audio?
No, I don't think so.
Can you hear the AC or anything? No, right?
No, we can't.
There are few in the waiting room.
Hi, everyone. Thank you for joining. We'll start in another 2 minutes. And while we're waiting, may I request you to please enter your details in the form that we're circulating in the chat window. That'll be a good use of your time. And Anya, if I could request you to please put the link to the form in the chat window.
Sure.
Hello, everyone. It's a pleasure to have you with us this evening. We're here to discuss something which is one of the most discussed topics, of course, diabetes remission. And to do that, we have a very senior guest with us today, Dr. Hema Venkataraman. She's a highly skilled medical professional with over 22 years of experience in the field of endocrinology. She holds a prestigious list of qualifications Her degrees are there for all of you to see. So Dr. Hema serves as the medical lead for chronic care at Practo and is currently a consultant endocrinologist at the University Hospitals Birmingham in the UK. She also holds the position of honorary senior lecturer at the University of Warwick and Birmingham. Throughout her career, Dr. Venkataraman has demonstrated an unwavering commitment to providing exceptional patient care and advancing the field of endocrinology through her research and teaching. Her expertise and dedication have made her a respected leader in her field, and it's an honor to have her here today. So please join me in welcoming Dr. Hema.
Thank you, Surabhi. I'm surprised you called me Dr. Venkataraman, which is what they call me in the UK. So great. Thank you, Surabhi, for that introduction. So this is me. And this is where I work. I work in a very large trust in the UK, which is one of the largest trusts in Europe. Actually, we employ 25,000 people, and we see a large variety of very complex diabetes with technology. We see pregnancy and diabetes. We see diabetes remission. We see a lot of Asian people. So, I mean, whatever I'm going to speak from now on comes with a wealth of experience, and therefore it comes with some credibility. And nothing that I'm going to say is not backed by evidence. That much I will assure you. I'm also going to take this time to introduce another presenter today is Vilasini. She is my colleague in the UK. We work together in the same hospital and we joined Practo together. So she is my dietetic lead who has designed this fantastic program, and her dietetic model is a big hit among our participants. So introducing her, she is a very experienced and equally qualified and equally experienced. So we are contemporaries. So we worked in the same hospital, 20 plus years of experience. She worked in the WHO and UNICEF. And then she actually leads a diabetes remission program in the UK. So she's a dietetic lead there. So she manages a few dietitians who run the diabetes remission program. So she actually is the dietetic lead of Practo Transform. So both of us will be presenting to you some facts of diabetes remission and our questions, and we'll open the floor to all questions to you. So the medical questions and the dietetic questions, whatever you may have. So my aim is to keep the presentation short. So Surabhi and Vilasini, I mean, I think both of us, we tend to talk a lot. So I've asked Surabhi to interject and stop us if we are going overboard, because the aim of this presentation is for questions and answers. Okay, so these are our disclosures. So I work as a medical lead for Practo and Vilasini is the dietetic lead for Practo. So these are our disclosures. Okay, so what is the agenda today? The agenda today is one, to tell you about diabetes remission and to explain to you the theory behind diabetes remission and the fact that there is evidence behind this. And then I'll talk about Transform, which is our Practo diabetes remission program. And then I'll open the floor for Q&A. Actually, I will give you gaps for questions and answers right in the middle, so that I'd like to, because it's a small group, we'll make it as interactive as possible. So please feel free to type your questions in the chat box and we can answer them as and when. So this is what.
Dr. Hema, you're on mute. Could you please unmute yourself?
Can you hear me now?
Yes, we can.
So was this slide heard?
No, unfortunately.
So until 2017, it's a good thing you didn't hear it because it's no more true. So until 2017, this was what was thought. Type 2 diabetes was thought to be this: permanent, incurable. And it was thought, and it is a serious disease. We all know that it causes eye disease, kidney disease. You don't need to be taught this. Everyone knows this. But what happened in 2017 was there was a breakthrough discovery, one of the biggest discoveries of the century, which you will remember, your children will remember, your grandchildren are going to remember if we do this the right way. So this was diabetes remission. Note that I'm not calling it reversal. So in 2011, they proved that the pancreas could be rebooted to start working again. If you removed the fat from the pancreas and if you lost weight, your pancreas will start working normally again and you will not have diabetes again. And this is again the same thing. So as you lose weight, you lose fat in the pancreas will start working again, a process called rebooting. So this is again the study called the Direct study. So if anyone talks to you about diabetes remission, there is evidence. The Direct study was the big landmark study that will be etched in history forever. So they proved that about 50% of people who actually did this low calorie diet, they went into remission at the end of 24 months, 12 months, at the end of 1 year. This surprised everybody, surprised the researchers themselves, surprised all of us. We never thought these numbers would be as close to 50%. So that has changed the way we doctors look at diabetes remission. None of the doctors would talk about diabetes remission before 2017. All we did was write prescriptions. You would wait in a clinic and you would get a prescription and that would be sent to you, and that's it. Things have changed now. So in the UK, there is a national rollout of the remission program. So if any doctor tells you remission is not true, it's a myth, and there's no truth behind diabetes remission, it is your right to question, to say that a country like England is actually rolling out this program nationally. So there is truth in this and there is evidence in it. Yes, not everybody is suitable for diabetes remission, but remember, it is your right to ask for diabetes remission, especially if you're newly diagnosed and you're slightly on the overweight side. You should ask for it because there are countries rolling it out and it cannot be without evidence. So what is remission? Remissions means achieving a HbA1c of less than 6.5, being off medications and remaining off medications for at least 3 months after a 6-month period of lifestyle change. That means good diet and good activity, physical activity, and weight loss. So less than 6.5, at least 6 months of change, and 3 months of medication. So you need 3 months of medications to say, call it diabetes remission. Therefore, I will caution you. There are a lot of other companies that say, I will reverse your diabetes in 5 days or 30-day diabetes remission. Reverse is the wrong word because it is not a final thing. If you lose your rigor and you go back to bad habits, you start gaining weight, you don't exercise, you will get diabetes back again. Remember that. And therefore you cannot call it reversal, you should call it remission. And you need 3 months of medication to define remission. And therefore gone in 5 days or 30-day challenge, they are not claims to be believed. They're not unscientific claims. And me and Vilasini, right from the beginning, we have committed to responsible marketing, and we don't want to make claims that are not scientific. Who can achieve remission? I think this is a very important question in all of our minds. Is it for everybody? It's not for everybody. So it's only for people with type 2, not for type 1. Type 1 diabetes means you are on insulin forever. You have to stay on insulin, and that is the safest thing to do. If you come off insulin with type 1, it is life threatening and fatal. People with short duration of diabetes have a better chance. Having said that, there is data now about 10 years also. Now 50% of people can achieve remission even about 10 years. There is new data coming, but till now the data was only under 10 years. So duration is definitely gives you a marker of how likely you are to achieve remission. Lower HbA1c at baseline, better chance. So if you have a HbA1c of 15, in 3 months, I won't be able to take you off medications. But you might take 6 months, you might take longer, but I won't say no. But whereas if you have a HbA1c of 8, good chance of remission. Fewer medications, good chance. You are strangely, the heavier you are, the better chance. If you are very lean people with diabetes, we really struggle to achieve remission because there is a problem with the pancreas. The pancreas is actually inherently smaller, and therefore this rebooting of pancreas may not be possible. But we are still working on it. But I'm very careful to promise remission in somebody who is lean. How can you achieve remission? This is a point I'm going to pass on to Vilasini, because Vilasini is the person who has actually designed our dietetic method. And there is so much in the market. So Vilasini, over to you. There's so much in the market about various diets. There's keto, there's fasting, etc. What is your thought and what is the best way to achieve remission, Vilasini?
So thank you for that beautiful presentation, Dr. Hema, and it was lovely to hear from you. And that's a good question because day in and day out, we are seeing loads and loads of promising diets and in YouTube or in other different channels like intermittent fasting, keto diet, low cal, low carb diet, lots of diet. And the question is, are these diets are they doing what they are supposed to do? And most of these diets are very, very short term. And not only that, whenever you go on a dieting, it also gives you other challenges such as your so there are patients who have got into other kind of emotional kind of trauma because they get into it's more challenging, it's more short term, and also people develop that obsession with the weighing scales and they do continuously weigh. And also there's other kind of it's not sustainable, and it is not either available at all times, because people on dieting cannot go through that dieting long term, because there will be events where you can't maintain their diet, so it's not sustainable either. And moreover, people can be very anxious, very stressful, and their entire relationship with food will be a big question, and this could also lead to other mental health problems like eating disorders, trauma, stress, anxieties, etc. So the best way for achieving diabetes remission is through healthy eating plan, which we call as HEP. So I would advise, just try not to follow the short-term dieting and tune your focus and approach to healthy eating plan. So that would be helpful, Dr. Hema.
So I
And to
remember
achieve
you
remission.
always saying, Vilasini, I think this is Vilasini's mantra, what's available and what's sustainable. And every single meal plate that you will see in our program is made in, that's the next slide. So made in your own kitchen, actually. So Vilasini, I think in our program, we don't need to go out to buy. I think I'll come to that in the
No.
next slides. So I will pause here because I think now that I've introduced Vilasini and she has shared some of her valuable thoughts, it's good time for questions. I'll break for questions and then I'll talk about our program and I'll break again for questions. So if there are any burning questions about remission itself, please go ahead and ask because this session is for questions.
That was a very interesting presentation, Dr. Hema. May I request you to please repeat the last slide, also in Hindi, because we have a lot of people who come from different parts of the country, and what you said made so much sense.
Sure, I'll do that because Vilasini may struggle in Hindi, right? Vilasini, shall I translate you what you said?
Absolutely. My Hindi, I'm not sure of my Hindi. I don't know Hindi. Thank you,
Yeah.
Surabhi, and thank you, Dr. Hema. That was a very valid point. Yes, we need to cater to people
So,
with language.
जो मैं बोलने वाली थी, डायबिटीज रेमिशन मतलब डायबिटीज को हटाने के बहुत तरीके हैं. एक है इंटरमिटेंट फास्टिंग जो बोलते हैं दिन में खाते हैं और शाम को 6 बजे से नेक्स्ट 11 बजे तक नहीं खाते हैं. दूसरा लो कैलोरी डाइट है, कीटो डाइट है, ऑपरेशन भी है, कोई ड्रग्स भी है वेट लॉस के लिए. ये सब करने से डायबिटीज चला जाता है टेम्पररीली. पर विलासिनी जो बोल रही थी कि ये जो तरीके हैं वो प्रैक्टिकल नहीं है, रोज नहीं कर सकते. जो रोज आप खा सकते हो एवरी डे आपकी जिंदगी भर वो ही करना है. ये नहीं कि 15 दिन आपने किया या 1 महीना किया, डायबिटीज चला गया और बैक टू स्क्वायर वन. जो आप रोज रोज कर सकते हो, हर दिन कर सकते हो, अपनी जिंदगी भर कर सकते हो, वही खाना खाना चाहिए. तो हमारा प्रिंसिपल ये है, विजन ये है कि जो आपके घर में बना हो, इजिली बना हो, अवेलेबल हो और जो आप रोज खा सकते हो, इजिली कर सकते हो, वही है. इजी मतलब सबसे इजी नहीं है, कुछ तो काम करना पड़ेगा ना डायबिटीज रेमिशन के लिए. तो डिसिप्लिन की जरूरत है, पर ये नहीं कि कोई भी फैंसी डाइट है कि कहीं दुकान में जाके खरीद के आए, कोई मिल्क शेक पिए, ऐसा नहीं है. जो आपके घर में रोज बनता है उसी को थोड़ा बदल के हम देंगे डायबिटीज रेमिशन के लिए. Does that help, Surabhi? Any
Absolutely.
questions?
That was very well captured. So while we don't have questions on the chat window, we have received a lot of questions from people who entered
I have a question.
separately.
Please.
Go ahead. Please go ahead,
I
Mr.
have
Rahul.
diabetes for since 2010. That was time it got detected. Initially for 1.5 months, I was on insulin and later on shifted to tablets through better control. But now post-COVID, I got twice COVID last in last year. So the HbA1c has shot up beyond 9 and now it is hovering around 9. So I'm not able to visualize how I can control it because of, in spite of having a lot of medications and diet control, I'm not able to reduce it to the extent that it would be in a manageable range.
Sure. You're on tablets, not on insulin, sir?
Tablets for past 12 years.
And when you say diet, you're eating normal homemade diet?
Yeah.
कोई special diet पे नहीं हो आप?
Normal means I have control over the food items which I should take.
Yeah.
Less of carbohydrate and all that I'm
Sure,
taking.
I think you should, because you have 13 years of diabetes, I will be a little bit cautious to say, or 12 years of diabetes, I'll be a little cautious to say we'll attempt remission. But I am definitely going to say that your diabetes can be far better controlled with lesser medications. Because what we think is healthy, most of our patients, Vilasini is going to butt in Vilasini. If somebody tells you that they are on a healthy eating at home, what is your answer to that and how do you deal with that?
Thank you, Dr. Hema, and thank you, Rahulji, for that lovely question. Healthy eating means normally we try to control the carbohydrates, and we try to control the visible sugars like jaggery, honey, sugar, and rice. Of course, we try to control. But what we try to forget is, are we including the other elements of food such as proteins and fiber in the form of vegetables or salads? Because without the fiber, without proteins, it's very highly unlikely that the blood sugars will stay under control. You might eat less rice, but even with that less rice, we are not going to eat along with vegetables, along with proteins. Your blood sugars are going to go high. You might think, I'm eating very less rice and why my sugars are going high. If the blood sugars have to be in the range, you need to introduce two strong pillars. One is fiber and one is proteins. So try to make sure you're including the fibers and proteins in your meal and reduce your carbohydrates and all of this in a proper meal plate. And try to chew nicely, because the more you're chewing, the more the food stays in the tummy, and that will help to control the blood sugars well. So it's
So in
about
answer to your
understanding the
question,
different types.
so Rahulji, I think answered in summary, Rahulji, I think you'll definitely benefit from our program. There is no doubt. When anyone tells me they're eating normal homemade healthy food, I know they're not eating healthy, because India में जो normal homemade healthy food है, it like Vilasini very rightly put it, वो carbohydrate heavy है. जो भी आप उतना राइस नहीं खाओगे, आप राइस ही नहीं खा रहे हो, फिर भी you're eating roti. We do not eat protein enough. We do not eat fiber. No Indian household has that thought
No
process at all
proteins.
yet. So I think you will
Absolutely.
definitely be helped by the program. You can book an eligibility consult with one of our doctors. They will go through your medical history and they will tell you a goal and they will tell you what they can achieve for you. Other option is come and experience our program for 1 month. We have short 1 month program just for people like you who don't know, can I do this? Is this program for me? Come and join us for a month and experience it. You'll be given a sensor also that will check your blood sugars every minute and it will tell you आपके खाने से क्या हो रहा है, your normal regular food. So, I mean, from your question, you're the typical patient who is in our program, sir. We have plenty of people like you, and
Absolutely.
I'm very confident we can help you. So please
I think we can
join us.
optimize. Yeah, definitely optimization is possible. Maybe
Sure.
optimization and bringing your blood sugars under control and reducing your medication is definitely possible with the program, sir.
Yes,
Definitely.
I'm not promising remission because there is no data at 13 years. But we have patients in our program who have achieved it. So I want to be safe, but in my head, I'm also thinking, why not remission? So please feel free to join us, sir. I think there is a lot we can offer you. I
Absolutely.
will promise,
Thank you.
in the next few slides, I'll show you what happens in our program that might answer your question. Surabhi, can I go ahead for the next talk about transform so they can ask more questions if at all?
Sure. Before that, there's one question I think you'd like to address now. This is from Ms. Debelina, and she wants to know what are the specific symptoms for identifying a diabetic patient?
So the beauty of, or the sad part, or the beauty of diabetes is it is asymptomatic, right? So that's why a lot of people are walking around. If I sometimes go on the streets and I look at people and say he could be diabetic, he could be diabetic, he could be diabetic. 50% of India's population India's diabetes population is undiagnosed purely because there is no symptoms. There are no symptoms. So it's important to know that unless your blood sugars are really high, above 400 and 500, you're not going to get symptoms. At 250, you can be very happily roaming around the streets with absolutely no symptoms. The second part is you can have, once you start having symptoms, very high sugars, you will start having thirst, going to the toilet, being more often, passing urine, feeling hungry, losing weight, having infections. And in women, if you're gaining weight, difficult pregnancy, you can have symptoms. There are lots of other symptoms, but majority of people walk around with no symptoms and feeling perfectly well in themselves, and that's why diabetes is a difficult one to diagnose. So important that all Asians, I think all Indians, we are at high risk. It's important that once you cross 30, and if you're overweight, even slightly overweight, or if you have family history, please go and get a HbA1c done every year. Does that answer your question, Debelina?
Yes, thank you.
We can move forward, Dr. Hema. There are more questions, but we can address that along the way.
I will quickly talk about our program because the reason you guys are here is to know about my program. So I will talk about our program and then you'll have more questions, I'm sure. So the birth of Transform, we call it Transform. I'm sorry, it should be a capital T. But yes, birth of Transform. So why did we actually come up with this program? So there were there are lots of organizations like Apollo Fortis, they provide healthcare, and there's technology. And we at Practo, we thought we will merge technology, we will merge people and the clinical base of whatever is existing into a program called Practo Transform. So yesterday, I mean, incidentally, me and Surbhi were talking about this, and there are articles in the paper that talked about the average consultation time for a doctor in India. You walk into a diabetologist clinic, and roughly, I mean, what is the longest you have been in a clinic? I mean, what is the average time? You might know. And I was reading a paper across all countries. There were about 60 countries that they looked at consultation times in the hospitals, and it is sadly in India it's 2 minutes. The average time spent by a doctor with a patient is 2 minutes in India, compared to 20 minutes in the rest of the country. And we thought you cannot, tackle a problem as complex as diabetes with seeing a patient for 2 minutes, maybe even 5 minutes, maybe even 10 minutes is not enough. In the UK, I see a new patient for half an hour and a follow up for 15 minutes. And I'm sure Vilasini sees them for more than an hour. And so we thought, we need to bring our best practices here onto India and get this to change. So this is our program. It's a 6-month program. I'm going to let Vilasini talk about the 3 phases of our program, because I think me and Vilasini co-designed this program. So she's equally the owner of this. So I'll let her talk about this 6-month program and the 3 phases. Over to you, Vilasini.
Yeah, thank you, Dr. Hema. So in the starting of our program, the phase 1 we call as a transform phase, which is from week 1 to week 12. That's for 3 months. So what happens as the patient joins in, there'll be a detailed health assessment we call as a pre-assessment questionnaire, and we get a lot of information and details. And then there will be a blood test, which will capture their updated HbA1c and other vital profiles, biomarkers. And also the next one, they'll be delivered continuous glucose monitoring, the CGM, and also a video will be sent to the patients on how to apply that and how to use it. And then the further data analysis will be there. And during all this is happening, the first from that 14-day to 19-day, there'll be initial consultations by the medical team, by the dietetic team, and by the physical fitness person. And it is all a robust consultation, not just a consultation for a few minutes. The medical team will do it for 30 minutes. The dietetic team does the same for 90 minutes. And the physical fitness expert will also do the same, a detailed consultation to understand the patient's overall holistic picture. And then we will be requesting the patients to post in the meal plate pictures. In terms of dietetic side, the program works in such a way the patients will have to take a photo of their meal plate pictures and put it on the app group. That's basically the WhatsApp. And then the dietitians will give the real-time feedback to the meal plates and like how to tweak their meal plates. And it's not only sticking to the meal plates, it will be also for the snacks and everything. So basically hand holding at each point. And simultaneously, the physical fitness expert will also conduct a lot of sessions, group sessions, and that will happen every day for a defined period of time. And also, and other questions and other relevant questions will also be answered by the medical team as and when it comes. So it will be a continuous hand holding, mentoring and supporting of the patients in the 90-day period. That's the most of a learning phase and a lot of learnings. And also additionally from the dietetic side, we will be rolling out modules, weekly modules. The reason for designing the weekly modules is to give patients more accurate and reliable information so that they don't go to unreliable, untrustworthy information on the Google or anything. So most of the modules are more pictorial and most of the questions will be answered in the modules. So the participants are encouraged to go through the modules and we are there to clarify the questions. So a lot of hand holding in the first 3 months. And once they have finished the journey, the transform journey in the first 3 months, then from the day 90 to 180, it's the sustenance phase, which is more crucial because you have learned all the nuances of diabetes management in the first 3 months. So the other 3 months is crucial to apply that knowledge and practice on yourself. It's kind of a self-led learning. And of course, with our support, patients will be added on to a group called as a diabetes group. And again, they will have a peer support and a peer group app coaching will be there because the participants will be posting their meal plate pictures. And of course, the dietitians will be there, the mentor and the medic team will also be there. So again, we will pitch in and we will give the feedback on the relevant plates, but mostly it's peer driven. So this is the whole overall program phase, Dr. Hema and others. So from 0 4, first 3 months is more of a learning phase, and the next 3 months is more of a sustaining phase and practical. executing
Just
phase, more with
to
this.
add that your medications will be reduced before
Absolutely.
3 months itself, some of which I think once we start the diet, we see that medications need to be reduced as early as day 3, day 4. Blood sugars start dropping so rapidly because remember that your blood tablets were being matched to eating 6 chapatis. Now, suddenly, when you reduce your carbohydrate, add protein, add fiber, you don't need that tablet at all. So, within three,
Absolutely.
4 days, 1 week, we are cutting down medications. And by 3 months, a lot of them come off medications, but we have to do it carefully and use our judgment. So there is no rush
Absolutely.
to stop medications, but we want to make sure you're safe.
Absolutely.
So
And the other beauty of the program, sorry, Dr. Hema, the beauty of the program is within the 3 months, you have the multidisciplinary team meeting.
yeah, I'll come
It
to
is
that in a minute.
every,
I'll
exactly. So every week 6 and week 12, we will have the multidisciplinary team, the doctors, the dietitian, and the physical fitness expert will come, will analyze the case, individual MDT, we call as MDT approach. Your
lastly we'll
case
come
will
to
be,
the slide for that. I'll explain that anyway.
oh, excellent, excellent, Dr. Hema. So that is also a part of the program.
Sure, sure. So this is just our team, our very small core team. We have a wider team, but these are people who we deal with on a regular basis. So you will see them on a daily basis in this program. And so, human touch is really important, and that's what we lack today, especially after COVID. So rather than run our program based on algorithms and a bot talking to you, we have these people who will talk to you on a daily basis. So this is a sensor that we use. It's a Abbott FDA approved sensor by Libre Abbott, and this sensor checks your blood sugars every minute, and every 15 minutes it will consolidate it. So every time you scan, it will give you a reading and it will tell you your graphs. So every time you eat a meal, it will tell you what happened to that meal, what happened to your blood sugars with that meal. Every time you did a walk, every time you slept, you had a drink of coffee, you had juice, it will show you and shock you and educate you. There are lots of our patients who decided to stay on this for life because they said, I mean, this is the most brilliant thing that ever discovered by man. It is an enormous, awesome device. We will use this, you will also use this, and together we'll help your diabetes get better. So I think it is a dietetic heavy program along with physical activity. So our program is a lifestyle program. And therefore, I'm going to pass this really, really important slide to Vilasini. I think I'll let her talk about what our diet is like and how our dietetic module is different from the rest. Over to you, Vilasini.
Yeah, thank you, Dr. Hema. So our dietetic module is designed on the principle of intuitive eating, which means we are not going to give any kind of prescriptive diet, or we are not going to ask you to buy any fancy products in your kitchen. So whatever you're having in your kitchen, within that available food products, you're going to modify your plate according to our recommendations. That's what it is. And there is no prescription diet chart or anything like that. So we are going through the principle of intuitive eating, which is a self-care eating framework which integrates intuition, rational thoughts, emotion, and your basic instinct. So it is built on the key principle of ditching the diet mentality. There is nothing called as diabetic diet, so we are not going to go through the diet route. And next one is your feeling your hunger. You need to respect your hunger and feel the fullness, how to use the hunger scales, and also embrace the food. Eat a variety of the food, and there's nothing called as good or bad food. So how we are going to incorporate all varieties of food. And last but not least, stopping the food policing. You're not going to be obsessed with something. You're not going to weigh yourself every day. So overall, another important thing is you'll be supported of how not to see food as a comfort. So all these comes under the tag called as intuitive eating. That's what we are going to do. So again, as I mentioned, you're not going to be pushed to buy any specific products or spend more money on that. Whatever you're making in your day-to-day kitchen, in your meals, the same thing will be tweaked according to your interest, but the proportions will change. So you will be able to reduce something, you will be able to include something. Again, that is within the available products in your kitchen. So these are the beautiful plates from our patients gallery. And also one more thing, the diet for diabetes doesn't have to be boring.
So these are real
This is
plates,
so
right,
interesting.
Vilasini? These are real
Yeah,
plates for participants,
these
right?
are real plates, and look at them. They are not boring at all. So patients who are having diabetes or who want to lose weight doesn't have to eat a boring meal. Look how colorful the plates are. It's fantastic, colorful plates. So at the end of the day, it's empowering you to participate in your own healthcare management and taking the food under control and retune your overall approach and behavior to eating and food as well. That
Thank
is
you.
what is all about. That is our dietetic approach for this Transform program.
Thank you. That's awesome. I like the fact that there's no prescription and you lead the program. The patients lead it. If you're North Indian, you eat North Indian food. If you're Bengali, you eat fish. If you're Keralite, you eat your Kerala rice and your fish. If you're Tamilian, you eat your dosa. Whatever place you come from, you continue, you eat your cultural food. We are not going to change this. So there's no point in curing your diabetes and being miserable. So I think it's about enjoying your life, but in a mindful way. So this is a plate that I think Surbi or anyone else, I mean, go ahead and tell me what you think about this plate. So Surbi, do you want to have a go? What do you think about this plate? Or I think we had a question from somebody, Rahul ji. What do you think about this plate, sir?
Doctor, it is good. We can change on a daily basis, and
Huh.
it will be good that we have a better balanced diet,
Huh.
keeping up to
इसमें कुछ
our
दाल है.
requirements.
So
Yeah.
this has dal, this has sabzi, it has
Mm.
roti, it has some salad also, right? It's quite a
Yeah.
healthy plate, right?
Yeah.
So this is a plate of one of our patients, okay?
Yeah.
So this was his blood sugar at that time.
Yeah.
And these were his
I would require just to add. I would require more of green vegetables to be
correct,
added to that.
correct, fantastic, fantastic.
Excellent.
Yes.
Well done.
This man was eating from his own home. And when he joined the program, he said he doesn't eat outside, he doesn't eat fried foods, he doesn't have sugar in his coffee and tea. So fairly, this is how most of our people with diabetes say, मैं sugar नहीं लेता, मैं बाहर नहीं खाता, I don't eat fried foods, I eat homemade. And this is what his plate is. He thought he was eating healthy. And these were his graphs, up and down and up and down and quite high. So, at that point, what we did, he joined this program. And like Vilasini said, what happens in our program, I think Vilasini, you can talk about something called app coaching. We call it app coaching,
Yes,
where
app coaching.
yeah, do you want to explain that, Vilasini?
Yeah,
Every
yeah,
day?
yeah. So what happens is every day the patient used to take a photo of their meal and send it across through the WhatsApp, and they will upload the photo in the WhatsApp. And the dietitian, one of our dietitians, will go through the plate, analyze the plate, and they will teach the patients of how to modify the plate, same plate, so as to bring the blood sugar levels down. So I think the picture is from the same patient. Initially, the blood sugars were ranging between 225-ish, above 200. And slow and steady, it started as they are making the changes according to the dietary recommendations, what we are suggesting. The blood sugars will also drop down and it will come within that blue zone. And so it's kind of
How often does the
it's
dietitian talk to the patient, Vilasini?
every day, every meal plate will be analyzed. Each and every meal plate will be analyzed. So good plates, bad plates, all the plates will be analyzed, and it's every day, everyday meal plates. So
So,
breakfast, lunch, dinner, and snacks, all.
so it is basically like spending 6 months of your life daily with a doctor and a dietitian at the end of the phone. So, I mean, I don't think any program offers this. There are programs that offer every 6 weeks you meet a dietitian or every 4 weeks, but here every day. And if you don't send a plate, our dietitian will say, "Where is your breakfast? Have you had breakfast? Have you had lunch?" We call our dietitians the mummies of our program because even if you forget to have lunch, they will remind and say, "Where are you now? Have you had lunch?" So it's a very personalized program where we handhold you at least for the first 3 months very closely. And this was what Vilasini was mentioning. We
Yeah.
don't work in silo. So the dietitian, the doctor, the fitness person, and you, we are a team. And we meet together. So this is an MDT meeting where the patient is actually talking to the doctor, dietitian, fitness.
Dr. Hema, can you unmute your mic, please? Sorry.
Sorry, I don't know why I'm getting muted. So this is the MDT team where all of us meet together with you. And we talk to you every few weeks. We have this meeting where you can share all your difficulties, the fitness person. So unlike in other healthcare plans, here the doctor knows exactly what the dietitian has said. Dietitian knows exactly what tablets you're on. The fitness person knows all your medical history. So we all talk to each other and we talk to you together. This is our fitness guy. He is working up the Himalayas now. He does video sessions from there, somewhere near Simla. He does 4 or 5 sessions every day. And we have a yoga coach who also does a session every day, 5 days a week. And so this man's plate became, from there, it changed into this. So instead of 2 chapatis and rice, he ate only 1 large chapati. But in addition, he ate dal, he ate sabzi, he ate paneer, he ate other veggies, and he ate chaach, which is buttermilk. So a lot of calcium, vitamin D, protein, fiber, everything was there in that meal compared to a big carbohydrate load in that meal. This was his other meal. There was black eye beans, chapati, sabzi. This was omelette for those people who eat meat. We don't ask you to become vegetarian. If you're eating meat, you eat meat. If you're vegetarian, you remain vegetarian. So there was a nice big omelette there, full of proteins, good fat, and there's bread with peanut butter, and there's a lot of veggies there. So very healthy, very balanced meal, like Vilasini said, and filling too. So that's what he did. So this is about believing that this meal is enough for you, compared to saying, oh, मैंने एक ही bread खाया. It's not like that. Most of our patients are surprised that they are full and they feel more energetic because this meal is much more healthy than this meal. This meal has a little dal and that's your only source of protein. But look at this meal. It's fantastic. So I think it is about changing the way you think. आपके सोच को बदलना है कि आपको 2 रोटी और इतना चावल चाहिए स्ट्रेंथ के लिए. ये नहीं है. आपको ये इससे ये करना है. हम कम खाने के लिए नहीं बोल रहे हैं, पर आपके प्लेट में सब कुछ होना चाहिए. प्रोटीन होना चाहिए, फाइबर होना चाहिए और कार्बोहाइड्रेट होना चाहिए. सही सही प्रमाण में होना चाहिए. तो that is exactly what we do in this program. So this is a session. I'll pass on to Vilasini. This is a group session that she does every weekend. So over to you, Vilasini.
Yeah, so alongside the app coaching, we also make sure our patients are getting a lot of accurate and reliable information, and this is a forum for all the patients to come in touch with the dietitians, and they talk a lot of things. So we designed thematic group sessions. So each week we talk about different themes like supermarket, how to read labels, what are textures and how are they important for the satiety, and what are different types of sugars, and how to manage the lapses and relapses, how to manage emotional cravings, and what is the difference between an emotional craving and a normal hunger. So, and what is comfort eating, and what it is like with diabetes and heart health, and how smoking, sleep and drinking can affect diabetes, blood sugar management. So wide range of thematic topics will be discussed every week, and we have lot of questions, lots and lots of questions on that, and it's a huge success for us. And also patients are all lot more happy because this is an information that they can't get from outside.
So
And
Vilasini,
also,
for a dietitian, I get the fact that you need to be a little bit of a psychologist too, right? In actually,
absolutely,
so
absolutely.
so a lot of
Because
sessions that Vilasini does are not purely dietetic sessions. They actually
no,
talk about how to change the way you think about food, not just dieting. So is that
absolutely. Absolutely, absolutely. Because remember the central nervous system, and because we have something called as a gut-brain axis, which is a bidirectional communication between your central nervous system and your intestine. So these kind of often they used to communicate each other, and this is what it regulates the appetite. This is what it gives you the fullness. And also we talk a lot about comfort eating and emotional eating and snacking. So it's more of a dietetics and a psychology. It's more together.
Yes.
So this is where we open up, and this is where we stand out as a Practo Transform dietitian, and this is where our program stands out. It's not
And you
just
also,
about food. It's more
I think
than
the
that.
other thing is you see a lot of other participants in the same journey as you. So you meet other people who have gone through the same journey, and that really helps, listening to others' experiences.
Feedback, recipes, lot of things, sharing experiences, recipes, feedback. So much of peer-driven sessions are there. So this is one of the unique thing from our program. Yeah.
Sure. So this again, I'm coming back to the same person. His graphs were like that, and he changed his plates, and these are his graphs. Look, he's almost touching the lower zone. He's touching nearly 70, and we had to take him off lots of medications. He was on insulin. We had to take him off insulin. He's 8 kg lighter. He's on some tablets still. HbA1c 6.5 now on tablets. So real person, real story. We have hundreds of patients. We achieve decent good amount of weight loss. Our HbA1c reduction is about 1.5%. 8 to 10 kg weight loss in the 3 to 6 month period, depending on how you started off. 95% of patients saw reduction in medications, either stopping or completely reduction. About 40%, about 1/3 are completely off all medications. So we have very good results, and we are really proud of them. We are presenting some of our results in an international forum in April in the UK. So one of which has been chosen to be a oral presentation, which is very prestigious for us. And it's also reassurance that what we are doing is scientific and what we are doing is, the right thing to do. So we'll be presenting these in April in the UK. So I'll stop here and take more questions and comments, please. Lastly, I think there's a question for you from Mayank Sharma. He's
Yeah.
asked if you can have sprouts twice daily in your daily meal. Suggest.
Of course, because sprouts, and this is one thing important for people who are on vegetarian diet. They highly lack in proteins, and their diet is mostly rich in carbohydrates. So sprouts and lentils are a good source of protein. So you can use them as a part of your proteins in each and every meal. And even if it is used thrice a time, it's fantastic. It's a good source of protein. And if you have access to sprouts, please do use them. And not only proteins, they do have other goodness also, like other minerals and vitamins, which are an added benefit. So I would suggest you to go ahead and use it even for breakfast, lunch, and dinner, all 3 meals, if you could.
Great, Vilasini. So you come and join us. You will have access to. We have a gallery of multiple plates. So you're not going to do this alone. We will share the gallery with you. You have multiple breakfast ideas. You have multiple lunch ideas, dinner ideas, and no complex cooking. If you're not so much of a kitchen person, we have simple plates also. Very simple
Absolutely.
plates. So
And
any
no boredom.
yeah, sure. Yes, no boredom. Yes, absolutely.
That
Any
was
question?
excellent, Dr. Hema and Vilasini. Thank you for such a wonderful presentation. Very enriching, I must say. And I will just invite others to ask questions, if any. And if there are none, maybe I can pick up questions from the form that people have submitted. Yeah. So Miss Monica wants to know, if metformin is stopped, can we survive on diet only?
Yeah, that is the whole purpose of remission, right, Miss Monica? So if you truly have type 2 diabetes and there are changes to lifestyle that will work, that is the whole purpose in diabetes remission. That's what we do. That is the aim, to survive on a good lifestyle. We don't even call it diet, like Vilasini said. It's a good lifestyle, healthy eating. If you lost weight, you don't need the metformin. That is the whole point. So, but I don't know your exact medical details. So we do a free medical consult for people who are not sure. So there is a doctor who will talk to you, take your medical details, and she will tell you whether you are eligible for the program, not eligible, what we can offer you. So please book a consult. Surabhi, how does one book a consult here? Is there a form or something that we are sharing?
Yes, Dr. Hema. So we have Miss Monica's details. We'll contact her after the webinar.
Yeah, please book a consult, Miss Monica, and I'm very sure answer to you is yes. Yes, you can survive without metformin.
So we have another question from Mr. Joshua. Can we have a list of food items which are diabetic friendly and also foods to be avoided, restricted? For example, Vilasini, do you want to take that? For example, potatoes.
Yes, sir. Yeah, thank you for that lovely question, Joshua. When you join the program, you'll get all the list of. There is, as I said, there's nothing called as diabetic foods. So we will be helping you to incorporate the naughty foods. I'll say naughty foods in a way that in a restricted quantity, but there is nothing called as a diabetic food. Number one, and as you join the program, when you join the trial program, you will be able to understand more about what is a what is a food that can help to manage diabetes rather than calling it as a list of diabetic food. So because again, it's not going to be in a prescriptive manner. So those kind of education is the first thing which we will do in our program as you join the week 1, week 2 modules. This is the program where the initial consultation, if you book the initial consultation, if you join the program, you'll be able to get to know a lot more about what is food and how it is related to diabetes management. Okay, Joshua? So try and join the program. And if you can try it out, join the trial program for a month. And that will be really helpful.
So Joshua, again,
Dr. Hema,
answering
do
your
you
question.
want to, one second, do you want to just change to the programs list so that people get an idea of
Oh, yeah,
the cost
sorry.
of the program?
Yeah.
Yeah.
So just to answer to your question, Joshua, that we don't work like the most dietitians do. So I remember the last time I worked with a dietitian in India, there'd be a long list of what to eat at 8 o'clock, what to eat at 9, what to eat at 11, what you should not eat, one big list of things what you should not eat and should eat. We don't work like that. The only thing we say is avoid direct sugar. That is the only thing we avoid, right, Vilasini? Even sweets once in a while.
I would say we avoid, but there are times where we can include in restriction quality, where kind of restricted amount, like once a fortnight or once a month, you can have a small amount of sweets. That is fine. So the idea is to avoid the word avoid and introduce the word restrict. So we don't use avoid, we introduce restrict or adjust or mostly restrict, and try not to use the avoid. So we are avoiding the avoid and we are
Potatoes
introducing
again potatoes, we don't avoid, we don't restrict.
Absolutely. You don't have to avoid.
You can have potatoes, but you'll have to watch the other carbs. So once you come to the program, it's great fun also. Come and join us. Join us even for a month. So our patients, if they have potato, we ask you to say potatoes like rice. So then you'll have to cut down the rice. You can have your potato. There is no such thing that you completely should stop, except maybe direct sugar on a daily basis, right, Vilasini?
Absolutely. So if you could join us even for the trial, the first initial consultation is a 90-minute comprehensive consultation, which will teach you more about the foods. So you'll get a lot more information in that consultation.
Sure. Thank you. So
that's a great point, Dr. Hema. Do you want to switch to the next slide so that everyone get to see what's the price for a 1-month program? Perfect.
I think there are a few questions, Surabhi.
Yes, there are more questions. So I'll move to the next one. So Dr. Annabarasan.
I'll just finish off Joshua. Yes, it
Yeah.
includes CGM, Joshua. There are few plans. Most of the plans include CGM. Please contact the team.
Sure. So we'll be in touch, Joshua. There's a question from Dr. Annabarasan. He says, I feel tired and sleepy few minutes after tiffin, lunch, and dinner. Why? And the second question, I don't know if it is related, you would know. How can I stop frequent urination, especially during night?
Yeah, so the first one, answer to the first one is what we call it as a carb coma. So we call it as a carb coma, where if you're having a high carbohydrate meal, then very likely you're going to have a sugar rush. And therefore it's possible that at that point you can feel sleepy, tired, and not so active post meal. Also, especially the heavier the meal is, the more that feeling will be. And the way to avoid it is, like Vilasini will say, chew well, drink water in between, right, Vilasini? I think you are the person to answer.
Make sure you're including all your proteins and vegetables in the meal, and make sure it is not mushy, it is not liquid, or it is not sloppy. You have to chew well. The longer you chew, the tummy will take a lot of time to digest the food. It will stay in your tummy for a longer period of time. And drink plenty of water, and try to make sure you're eating only when you're hungry, not otherwise, not nibbling on. And try to move after your meal. Just don't sit in a spot so that you'll feel more tired. Try to spend your energy after your meal, because every meal will get the benefit when you move around. That will be easy for digestion, and also it will support your blood sugar regulation. So try to move around. Just a walking could help, or climbing up and down could help, or even simple household chores or gardening could help. So do not sit in a place for more than just straight after your meal. Just don't sit in your place for a longer period of time. Yeah, Dr.
So
Hema?
all our patients do a little 10-minute walk after their meals. That's all we do for activity. We don't ask them to run a marathon. But we say after every meal, a 10-minute walk inside your house or up and down stairs or something, that's enough. Also watch your meals. Pet bhar ke khana, idea of eating to your full stomach. That is something we need to change really. Uncomfortably full is not something we need to do. So, I mean, that is one answer to your first question. Answer to your second question, it's a more medical question. So I think it is important that you get yourself checked. There are two reasons for a man to go to the loo most very frequently at night. One is high sugars might be, just get that checked. Two is prostatic problems. Three is maybe water infection. If it's a long standing problem, and if you're an older man, it might be prostatic problems, but it might be something simple. Better get yourself checked. If everything is negative and if sugar is the only problem, I'll fix it for you. So Mr. Anil Kumar has asked something that we've missed, I think, Surbi. 27-year-old with diabetes with multiple complications. From 15 years, my HbA1c to 8 cured all my complications. Thank you so much, Dr. Hema. Apart from diabetes. Is that just a comment, Anil?
It looks like Mr. Anil is one of our participants. Is that correct, Mr. Anil? You can unmute yourself.
from 15 to 8. Oh, so he was HbA1c 15 and he's now come down to 8. I think he's one of our
Okay.
participants. So
Yeah,
thank you.
excellent.
Fantastic.
And
Yeah,
there's another
looks
question
like.
from Mr. Hari also. Yeah, Mr. Hari Krishna.
Does lack of
Yes.
overnight sleep result in hypoglycemia? No, it should not. Hypoglycemia, contrary to the popular belief, people with diabetes should not have low sugars unless they are on certain medications that cause low sugars. There are only two medications. One is one class of drugs called sulfonylureas, which is glimepiride or glycoside or glixid, whatever you're using. The other is insulin. If you're on any other medications, you should not have low sugars even if you didn't eat. Metformin does not cause low sugars. So don't have the myth that you have to keep eating every 4 hours, otherwise your blood sugar will go low. So all these things Vilasini will talk about in her, group sessions. There'll be a lot of new learning in the program. It will be a huge learning curve for all of you. So no, lack of overnight sleep should not result in hypoglycemia unless you're on some medications and you're starving. Anything
On the
Vilasini from
other
your
hand, yeah, on the other hand, a lack of overnight sleep can induce lot of cravings the next day. So you will be like kind of eating lot, and probably that will fluctuate your blood sugars high and low. That can really bring to your high blood sugars and low blood sugars. So make sure you're getting a proper night's sleep, because a lot of studies have suggested that people who don't sleep properly in the night are having a lot of nibblings and cravings the next day, because that's how your brain wants to keep you awake, and you can easily go into a snacking habit that can give you more than 500 calories, 300 to 500 calories. So make sure you're getting a proper night's sleep. That's my point.
Thank you, Vilasini. Feel free to unmute and ask questions.
That was very helpful, Vilasni. And if anyone has any questions, please ask. Otherwise, I'll pick another one from the form. So I'll go ahead. Vilasni, this one is again for you. Mr. Debashish wants to know what are the food and lifestyle tips for avoiding diabetes?
Okay. Food tips is just watch what you eat and eat only when you're hungry. Probably try to make sure you have a good composition of your proteins, fiber, and carbohydrates in your plate, and have a regular meal pattern. Don't eat and drink as and when you like, and try to make sure you are having consistent meal timings, meal pattern. So consistency is number one. Balance your plate with carbs, proteins, and recommended fiber, and portions and choices. Make sure your choices are good enough choices, and mindful eating. Make sure you're slowing down your eating, chewing very well, watch your plate, and don't get distracted. That is my only tip. Don't get distracted. Focus on your food, and try to avoid distractions when you're eating. And eat with your full five senses: see, touch, and also taste and smell. And these will be very helpful when you're trying to change your dietary habits in terms of diabetes management. And lifestyle tips: make sure you're active. So at least 30 minutes of activity per day is recommended. So make sure you're having a good proper meal. And also, as Dr. Hema suggested, after each meal, try to make sure you're moving at least. It could be either within home or outside, or at least climbing some stairs. And then 30 minutes of walking or any kind of activity per day is recommended. So do not leave more than 2-3 days of more than 48 hours without any activity or without any exercise. You don't necessarily have to go to any gym. You can easily do these activities at your convenience, but you need to do at least incorporate 30 minutes. So diet and lifestyle. So these are some of the tips you can incorporate to prevent diabetes or to prevent weight gain. Have I
Thank you,
answered the
Vilasni. That
question?
was very useful. It was helpful for me also.
Thank you, Sarabhi.
So I have another question from Ms. Debalina. Can a presumed diabetic patient get rid of diabetes if they haven't administered insulin yet?
Yes. Yes. Answer to your question is yes. It doesn't matter. Even people with on insulin can go into remission. If you have type 2, clear cut type 2, and you're on insulin, doesn't stop you from putting your diabetes into remission. Note that I'm very careful not to use the word reversal because it's not the recommended word, but I know what you mean. Whether you're on insulin, even if you've not taken insulin, no matter how high your blood sugars are, there is no, I'm not going to say no to remission to you unless you meet certain, unless you have some complications. So please book an eligibility consult. We'll go through your detailed history, medical history, your medications, and we will tell you at the outset whether there is a good chance of remission or whether we will just aim for optimization. So yes, Debelina, answer to your question is yes. Whether you're on insulin, not on insulin, whether you're on metformin, not on metformin, you have a good chance of remission. If provided your diabetes duration is not too long, not over 20 years, etc. So please book an eligibility consult, and we'll go through everything in detail. Surbhi, can Debelina book through the form, or you'll, if you, yeah.
Yes, we'll take care of that. We'll contact Debelina and take it from there.
Yeah, sure. Thank you.
I have a question, doctor. I did sign up for this pre-diabetes program like a few days ago.
Yes.
And I have purchased the CGM that was part of recommended kind of freestyle labor
Correct.
portal. Yeah. But I was just trying to access it on the portal to have the reports signed up over there. So the sign-in option is sort of two-factor authentication for email and mobile number. But as this portal doesn't show India as one of the options,
Correct,
so,
sir.
the reports cannot be on the portal. So is there any other
Yes,
way?
sir.
Yeah,
Yes,
please.
sir. Yes, sir. We have a way. I think what I'll do is I'll ask Chaitra to get in touch with you. We have fixed that. Yes, unfortunately, the Libre portal is only going to be launched in India in April. So until then, we have another way of doing this. I'll ask Chaitra to contact you. We have set up a Practo account, so all our patients do upload it on their on the portal. But I'll ask Chaitra to contact you and to help you with this.
Yes,
So
please.
everybody on the program, they have there's a mentor, Chaitra and Nishchit. So I forgot to mention there is a mentor for all of you. Any of such logistic problems, do contact her. I will ask her to contact you. It's very straightforward, sir. We'll help you with that, not to worry.
Yeah, and at the same time, I would like to appreciate for the last couple of days after signing up. I have like 2 or 3 mothers who are asking me, "How are you doing? How did you have your breakfast? Did you have your lunch? Where is your lunch plate photograph?" It really feels really good, and then part of a family. Thanks for that.
Thank you very much, sir. Thank you very much. So Hari is a spontaneous joiner. We didn't realize he is part of the program. He's just joined us. So it's very heartening to hear such positive comments. And I know that our dietitians are like, they are fantastic, I must say. So thank you, sir. I'll pass on your compliments to them also.
Definitely.
Are there any more questions? So as you can see on the screen, you can get started with 1-month program. There are only 6 spots remaining. Please enter your details in the form and then you just circulate it. And while you do that, I'll get to the next question. From Mr. Imran, he wants to know how to end diabetes at an early stage. I know the answer, but do you want to take that, Dr. Hema?
So I think we've done good with our education, right? All the non-medicos, all the Practo employees now know how to put diabetes into remission. So actually, I don't have much to do here. So, but yes, early stage is the best time. The moment you're diagnosed with diabetes, that is the time you need to think about remission. So do not let anybody tell you that no, your parents have diabetes, so that you are going to be stuck with diabetes. It is your right to ask for diabetes remission. You may or may not be eligible. That's a different thing, but that is the first method. So earlier on, diabetes remission is the first method, the first goal. And how do you put it into remission? By good lifestyle, by losing weight. If you're overweight, again, the definition of overweight is very, very different in our minds, right? So unless you're really, most people in India have a little bit, they like to have a little bit of a rounded tummy. And I walk around the streets, I do see people, I mean, having a little paunch is a sign of healthy living in India, right? But actually, if you calculate your BMI, etc., then you fall in the overweight zone. Sometimes I'm surprised, patients are surprised when I tell them your BMI is 25, you're slightly on the overweight zone. And they're like, no, doctor, I'm perfectly fine. But I show them the calculation, which means there's a lot of fat inside. So weight loss is a good method, is the method to put diabetes into remission. And how do you do that? By lifestyle, exercise, diet, etc. And also remember, you're not just losing weight, you have to lose the fat and retain the muscle. And to retain the muscle, you need to eat your proteins and you need to exercise. So it's a complex lifestyle change and a belief change, the way you need to think about your food and think about yourself also. People who believed that they were nice and lean now realize how much of fat they have lost from the belly. There was one guy today in the meeting, he said to me, all my belly fat is gone now. I used to think I was nice and lean, but now I know what really lean is. So yeah, come and join us. It's a great experience.
And it is a lifelong intervention, not just an intervention that stops and stops. You have to carry it lifelong.
Absolutely, Vilasini. Very great point. It's not a 6-month program. It's a lifelong program. You pay and come and learn for 6 months. But this is not to be done only for 6 months. This is the way you're going to, it's a way of life that we call Hinduism a way of life, right? This is a way of life. And this is what we recommend. It's almost like a cult or religion, I would say, and this is the way of life.
Great, that was helpful, Dr. Hema. With that, I've come to the end of. I have more questions, but I think most of them repeat them. Yeah, most of them are a repetition. So if there are no more questions from the group, I think we can end.
So we'll give you a few minutes. Please let us know if you have any questions. This whole session was to answer any questions that you might have. Is Hari Krishna okay? Hari, I'll ask Chaitra to contact you. I've just texted her. So.
And next week we have another webinar as well. Yeah.
So we just have 5 more spots remaining. If any of you are interested in buying the program, please enter your details in the form and log this program at the special price.
If you have further questions, do book an eligibility consult. It's a free consult. It's not a 2-minute consult. It is a 15+ minute or at least 20-minute consult where a doctor will listen to you and go through all your medical details. So please avail this free eligibility consult. Whether you're joining the program or not is the next question, but take this consult and get a taster of what we'll offer.
Great. I think we don't have any more questions, Dr. Hema, so we can end the meeting.
Thank you. Thank you, Surabhi.
Thank you, everyone, for joining.
Thank you, Vilasini.
Thank you, Surabhi. Thank you, Dr. Hema. Thank you, Surabhi, for organizing the wonderful
Vilasini.
I know it's very difficult, but you have done amazing work in scheduling and everything. Thank you so much for organizing this. Well done. And thank you, Dr. Hema, for such a wonderful presentation. Thank you all who have come today. Thank you so much for your questions.
I think next week we're having another webinar, so we'll let you know soon.
Absolutely.
Thank you all.
Thank you.
Thank you.
Thank you, sir.